to defer the calling of the roll. Duly seconded. Is there any objection? Hearing none, the motion is approved. May I call on Ma'am Sylvia to lead us on prayer?
In the name of the Father, the Son, and the Holy Spirit, thank you for every seat that has been filled here today, Lord, for every mind and heart that feels the presence of this meeting. We thank you. Only you knows what we are set to accomplish today, and only you can see the perfect detail in every end and every beginning. Your righteousness transcends our efforts and understanding. Forgive us for our pride that threatens to unqualify us. Strengthen our confidence in you have made us to be. Bless this meeting today, all those present, as well as the lives of those who will counter afterward. Thank you. In Jesus' name we pray. Amen.
Amen. We'll now proceed with the approval of the minutes of previous meeting. Kong Ging.
Yes, Madam Chair, I move that we dispense the reading of the minutes of the minutes of the meeting of the previous meetings, and the same be approved. So move, Madam Chair.
Second the motion.
Second.
There's a motion to dispense the reading of the minutes of previous meeting and approval. Dispense the approval. Duly seconded. Is there any objection? Hearing none, the motion is approved. Would like to recognize first the presence of the following members. Representative Alfonso Omali Jr., Representative, morning sir, Adrian Ebcas, Representative Ted Resco, Representative Alberto Pacquiao, Representative Prospero Pichay Jr., Representative Yasser Balindong, Representative our Vice Chair, Resurrection Acop, Representative Ansurudin Adyong, Representative Ging Swansing, our Vice Chair, Representative Maricel Nagaño, Representative Strike Revilla, Representative Olivares. For our resource persons, from the Department of Health, we have Director Crispinita Valdez from Procurement Service. From FDA, we have Ms. Merlita Pedron. From CHD Western Visayas, we have Dr. Rimia Nakananay, Ms. Pauline Yap from CHD Memaropa. From the AFP, we have Ms. Sheila Ellen Sumalbag Luis. From the DBM, we have Director Adrian Po Jr. from Procurement Service, and Attorney Jason Wayan. Mr. Jus Rex Abjero, also from DBM. From the Office of Civil Defense, we have Director. From the DILG, we have USEC, Judge Echeverry. From the DSWD, we have ASEC Rodolfo Santos and Ms. Abigail Antonio from DRFB. From DOF, we have Mr. Dominic Mariano from the Bureau of Treasury. From Philippine Red Cross, we have Dr. Arthur Catli and Dr. Jeremy Cordero. From PHA, we have Dr. Almora, Jaime Almora, the President. And we also have from Davao Regional Medical Center, Dr. Brian Dalid. Okay. Good morning, everyone, distinguished guests, and our esteemed resource persons. Today, the Committee on Health will tackle 3 important pieces of legislation and 15 local bills. First in the agenda is the draft substitute bill on House Bill number 6995, authored by this representation, which provides for the health procurement and stockpiling. House Bill number 6995, or Health Procurement and Stockpiling Act, seeks to protect health and safety by preventing and controlling the spread of diseases and other health hazards through the stockpiling of essential and critical drugs and medicines, vaccines, devices, and materials to effectively and swiftly confront the devastating consequences of public health emergencies. Next in the agenda, with would be House Bill number 269 and 6857, authored by Representatives Michael Edgar Aglipay and Prospero Pichay Jr. respectively, which seeks to institutionalize a standard upgrade and modernization of regional hospitals to create and establish a regional center of excellence for healthcare, or an apex hospital in every region in the Philippines. These bills mandate the DOH to maintain and operate said regional hospitals with at least 500 authorized bed capacity with a service mandate of a general hospital. Said bills also provides for the establishment of regional hospital modernization program to facilitate improvement and enhancement of physical facilities, equipment and instruments, and service delivery of all DOH identified regional hospitals. There shall be established also a Regional Hospital Modernization Commission, which shall be attached to the Department of Health and function as the implementing body for the proper execution of hospital or regional hospital modernization program. The authors of the bills number 269 and 6857 shall expound further on the importance and key features of the proposed legislations. Finally, there are 15 local bills in line and up for consideration and approval by the committee. The chair would like to emphasize that the committee is cognizant of the importance of establishing, upgrading, and modernizing hospitals and other health facilities across the country, knowing fully well that this will redound to the welfare of every Filipino, especially our impoverished countrymen in the far-flung areas and communities which are frequently affected by typhoons and other natural calamities. In this light, the committee, so far as reasonably practicable, approves the local bills notwithstanding the lack of or non-submission yet of the requirements prescribed by the DOH. As such, the chair earnestly requests the concerned authors of local bills to coordinate closely with the Department of Health as to the fulfillment of the requirements. I wish to emphasize that this representation as chair of the Committee of Health allows and sees to it that the local bills are approved by the committee to expedite the legislative process in coming up with the necessary policy and funding for the establishment, upgrading, and modernization of health facilities. This with the end in view that it will pave the way for the immediate delivery of essential and much needed health service to our people. Thank you so much. I would okay. Since we're having a technical problem on the presentation of the substitute bill, House Bill 6995, I would like to tackle first the committee deliberations on bills creating regional centers for excellence for healthcare or apex hospitals in every region in the Philippines. To sponsor House Bill number 269, I'd like to call on Representative Michael Aglipay to sponsor the bill entitled An Act to Institutionalize a Standard Upgrade and Modernization of Regional Hospitals to create and establish Regional Center of Excellence for Healthcare. Congressman Aglipay.
Oh, ma'am. Yes, ma'am. Hello.
Yes. You can proceed, sir.
Hello, good morning, Chairperson Helen Tan, and to my colleagues. I'm very happy and proud to sponsor House Bill 269, which I filed on the July 1, 2019, before the pandemic. I have been witness to the vulnerabilities of our healthcare infrastructure. Personally, before I became a congressman, I had experience wherein I brought our household health to government hospitals that did not accept her unless her case was critical already due to the scarcity of space to treat her. So the first bill I filed is this bill, House Bill 269, establishing regional health centers of excellence throughout the country, and having specialized hospitals to take care of all specializations in the health field. Our hospitals now, the best ones, government hospitals, I mean, in the country, have been around for more than 40 years. So it is due time, and because of this sign that the pandemic has given us, that we are vulnerable, and especially in the provinces, our regional hospitals are not equipped to handle the advanced treatment of ailments and other diseases. I plead with my colleagues that this bill be expedited, since a similar measure in the Senate is now being sponsored by Senator Angara. Thank you, Madam Chair, and thank you, colleagues. Good morning.
Thank you, Representative Michael Aglipay. Would like to call on Representative Prospero Pichay Jr. to sponsor House Bill 6857, entitled "An Act Establishing an Apex Hospital with 500 to 1,000 bed capacity in every region in the Philippines and providing funds thereof." Representative Pichay.
Thank you, Madam Chair. Madam Chair, Article 2, Section 15 of the Constitution provides that the state shall protect and promote the right of health of the people and instill health consciousness among them. In line with this, the state has the duty to provide and deliver accessible health services to the people. The rationale behind establishing an apex hospital is that we have to give the best medical attention in every region. Right now, there are only a few apex hospitals in the country. And in my case, the province of Surigao del Sur is very far from Davao. That's around 10 hours land trip. So when there are patients that will be referred to Davao, sometimes before they arrive, they already expire. And that is the reason why this representation would like to sponsor a bill establishing an apex hospital. Because in the apex hospital, that is the final referral. You don't have to refer them to other regions anymore. So every region should have that capability to be able to give the best medical attention to every Filipino. You know, it's a pity because Cuba has one doctor for every 3,000 patients. They have the best medical attention. In the US, it's one doctor for every 5,000. In the Philippines, it is one doctor for every 30,000. And some of them become congressmen pa. Kaya nakukulangan ng mga doctors dito sa Pilipinas. But, you know, it is really, it's a pity that for 2021, there is not even a single capital outlay as far as healthcare is concerned. And that is the reason why this humble representation would like to sponsor this bill to create an apex hospital, at least 500 to 1,000 bed in every region, so that that region can be serviced by that hospital. Thank you, Madam Chair, and I hope that this will be tackled immediately, because there is an immediate need for us to approve this. The pandemic is not an eye-opener, but our experiences actually is an eye-opener. Thank you, Madam Chair.
Thank you, Congressman Pichay. To hear from our resource persons, may I call on Representative from the Department of Health.
Good morning, Madam Chair. Good morning,
Sir
members of the Committee on Health. Madam Chair, let me read, Madam Chair, our position paper for this House Bill number 269, an act to institutionalize a standard upgrade and modernization of regional hospitals to create and establish a regional center of excellence for health care, as introduced by Representative Michael Edgar Aglipay, and House Bill number 6857, an act establishing an apex hospital with 500 to 1,000 bed capacity in every region in the Philippines and providing funds therefore, as introduced by Representative Prospero A. Pichay Jr. The Health Facility Development Bureau of the Department of Health, as the lead technical bureau for the Health Facility Development, supports the House Bill numbers 269 and 6857, which mandates the upgrading and modernization of hospitals in every region in the Philippines. These House bills are aligned with the Universal Health Care Act and the DOH Administrative Order number 2020-0019, which mandates selected apex hospitals to deliver specialty services and provide performance mentoring and technical assistance to its healthcare provider networks. The Department of Health, through the Philippine Health Facility Development Plan 2020 to 2040, and the pending department order on specialty centers, has already identified key DOH hospitals which will be upgraded to first become level 3 hospitals or a teaching and training hospital, and enhance capacities on identified specialty services depending on the burden of diseases, thus serve as an apex hospital. Part of the Philippine Health Facility Development Plan is the demand estimation for outpatient, inpatients, and national specialty center resources from 2020 to 2040. The demand for health facilities were projected in consideration of the fast-growing population, changing disease pattern, and the healthcare provider network envisioned in the UHC. This shall be basis for the development of health facilities in the country, which also includes the development plan of DOH hospitals. The department order designates strategically selected DOH hospitals through resource stratified frameworks to become specialty centers with a regional, subnational, and national catchment population. The DOH is also in full support of the House Bill number 5673 and Senate Bill number 1226, or the DOH Hospital Bed Capacity and Service Capability Rationalization Act of 2019. This bill shall streamline the process and grant DOH the authority to adjust the authorized bed capacities and corresponding service capabilities of all DOH hospitals aligned with the PHFDP. Therefore, this bureau, the Health Facility Development Bureau, would like to suggest that the provisions to the House Bill be aligned with the Philippine Health Facility Development Plan 2020 to 2040. First, upgrading the all level 1 and level 2 DOH hospitals to be a level 3 hospitals, prioritizing regions with no existing apex eligible hospitals in Mimaropa, Caraga, and BARM, and upgrading of selected DOH hospitals to have specialty centers with specified standard services, equipment, infrastructure, and human resource complement. The Bureau would also like to recommend that instead of creating a separate regional hospital modernization commission, the proposed measure would consider assigning the role of an implementing and coordinating body to the existing centers of health development and the field implementation and coordination team of the Department of Health. This would ensure a more efficient implementation process and simplify feedback lines to appropriate offices between the regional and central offices. Respectfully submitted, Madam Chair, and we will submit our signed position paper once signed by our Secretary. Thank you, Madam Chair.
Thank you so much. Thank you, Sir Rod Napulan. Would like to call on representative from the DBM.
Good morning to Mr. Yes, ma'am. Good morning po, Madam Chairman and honorable members of the committee. To date po, we are still finalizing our official position paper and we will submit it immediately once it has been reviewed by our principals. Nevertheless po, based on our preliminary evaluation of the contents of the bill, we do not object to its passage and we fully support this measure. But of course, are subject to our existing budgetary policies and standard po. That's all po, Madam Chairman. Thank you po.
Thank you, Mr. Abihero. May I call on our representative from the DILG, Yusek Ichiveri. From the DILG. Do we have representative from the DILG? From Philippine Hospital Association. Do we have Dr. Jaime Almora? From Medical Action Group. Do we have representative from Medical Action Group? Okay, if none, I would like to open the floor for open forum. Yes? Hi, sorry, Dr. Almora.
From the Philippine Hospital Association. Yes, the Philippine Hospital Association supports the concept of creating apex regional hospitals. However, we do have suggestions on some of the provisions, like in Section 4 of House Bill 269 on the revision of the coverage. We would like to suggest this following revision. The provision of this act shall apply specifically and exclusively to regional hospital with service mandate of general hospital that is capable to provide advanced diagnostic, life support, and surgical interventions not available in other hospitals in the region. It shall have full operational potential to maintain and operate a center for excellence on healthcare facility that provides affordable, quality, accessible, and efficient hospital services and healthcare to the general population throughout the respective regions. In addition, the regional apex hospital shall have the capability to become the center for isolation, quarantine, and trauma care for surge of patients in the event of epidemic, pandemic, or mass casualties in times of man-made and national disasters. This, Madam Chair, is for the purpose of addressing the future potential problems that hospitals will encounter, because we know that this is not the end. This current pandemic is not the end of these problems. There shall be other pandemics or epidemics in the future for new and emerging diseases. Also, Madam Chair, the real problem in the services of hospitals is not so much in the number of beds. So we are suggesting that we do not emphasize on the number of beds, but rather on the capability of the hospitals in terms of diagnostics, life support, and advanced surgical interventions, because this is the real problem in hospital services. Diagnostics, for one, the advanced diagnostic services are quite expensive because of the technology necessary to make available the technology and the cost of the technology that most hospitals cannot afford. So the regional hospital should have these expensive but advanced diagnostic machines. In addition, also, the life support, the services, the the machines, equipments necessary to intervene and prevent death should be available. These machines, equipments are also very expensive and not available in most hospitals. So we'd like to suggest that we concentrate more on the capability rather than the number of beds for this hospital. Also for surgical interventions. There are advanced surgical interventions that are not commonly available but should be available to provide in times where it is needed. And also special advanced surgical intervention are quite expensive also. So the government should be able to provide for them. Also, Madam Chair, I would like to proceed to Section 6 of House Bill 269 on the provision for creation of Regional Hospital Modernization Commission. In the composition of the commission, it is mentioned that it shall be composed of 7 members. I do not find, I can see here that the Philippine Medical Association is representative and also additional 2 healthcare professionals. So there will be 3 healthcare professionals, and there is only 1 representative for private hospital, which is the Private Hospital Association of the Philippines. I cannot see here the Philippine Hospital Association. The Philippine Hospital Association is the main organization is the organization of all hospitals, both government and private. It has 1,987 members, 60% of which is from the government, private hospitals, and 40% of which is from the government hospital. So would like to request that the Philippine Hospital Association be represented, because this is an organization that is going to speak for the whole hospitals, both government and private. That is my suggestion. Our formal position paper shall be submitted after we have additional inputs from other members of the board, the Philippine Hospital Association. Thank you, Madam Chair.
Thank you very
Thank you. Thank you so much, Dr. Almora. Yes, Yusek Ichiberi. Sorry.
Thank you. The Department of Interior and Local Government interposes no objection. However, Madam Chair, may we refer you to a perennial concern of local governments. Number 1, the question of whether or not local governments really has the capacity to maintain a level 3 hospital, or at least to sustain a good hospital. Because again, Madam Chair, we know for a fact that elections are being conducted and the change of leadership always happens. Not to mention, if a new chief executive is elected, that goes along with a new appointment of a medical director for a hospital. DOH, I think, is aware that not all hospitals are improving or are how would I say it, up to the standards of DOH in terms of healthcare. That's why majority perhaps are more into basic healthcare services, not into what we are now into of elevating the standard of hospital services. One question which the local government is asking, whether the funds that is given to the national government will be given to them instead, so that they could sustain the provincial hospitals. So again, these are questions which governors and mayors are raising. And I think this committee should also look into it, because again, even if we create a law on it and the concerns of the local government exists, the question of maintaining a standard hospital is still in question. So with that, Madam Chair, the DILG submits. Thank you.
Thank you so much, Yusek Ichiberi. If I may comment lang on the bill, napakaganda po ng intention ng dalawang panukala, and I applaud the authors for coming up on this proposal. But in support on the position of the Department of Health, no, that we aligned this with universal healthcare law and the health development plan created by the Department of Health. If I may inform lang the body that the intention actually under the UHC is that every regional hospitals will be upgraded and should offer a multi-specialty services, no? Yun yung na-envision natin when we created that or authored that UHC law. Ang reality, that's why very important po is yung funding requirement. We don't want to enact another unfunded law. No? Napakarami na po na ipasa ng komitiba na ito, as simple as increased bed capacity in every regional and DOH hospitals or provincial hospitals, but remains unimplemented because of the budget component. No? So we wanted to have that standard or center of excellence, hindi lang po sa regional hospitals but also in all of the health facilities in our country, no? Yun yung pwedeng basis din natin that na-ensure natin that the Filipinos are receiving quality healthcare services. When it comes to the establishment of Apex Hospital, no, this representation filed already a bill, but this is more of for Southern Tagalog, the establishment of Southern Luzon Multi-Specialty Medical Center, supposed to be established in Lucena City, that will cater the nearby provinces, not only in Quezon, but part of Mimaropa, part of Region 4A, and parts of Region 5. No? Why in the city? Because we look on the availability of doctors and health other allied health professionals. So, yun yung mga siguro importante na i-consider natin. And yung gusto natin na mag-create ng Regional Hospital Modernization Commission, as proposed by the DOH, we do have the Centers for Health Development in every region, I think, no, with representatives in different provinces. So po pwede din po yun na i-adapt natin, just not to parang create another body na baka ku-questionin na naman ng DBM on the funding component. So, maganda yung intention. Ito din po yung vision natin na sana in the long run, every region or every part siguro strategically located in different regions, magkaroon po tayo ng referral or Apex Hospital na available po yung services ng Heart Center, ng NKTI, Orthopedic, Children's, we do have Onco, and all other health needs, no, special health needs ng ating mga kababayan. So, I would like to hear from the authors if they are amenable on the consolidation of this bill and supports the position or the recommendation of the Department of Health so that we can approve this bill in principle, subject to style and amendment. Michael? Kong Michael or Kong Pichay?
Madam Chair, I have no
Yes, go
objection
ahead, sir.
as far as consolidating the two bills. But I think, Madam Chair, we have to look into the political will of this administration if they are willing really to invest a lot of money as far as health is concerned. If you notice, earlier on I said that not a single centavo was put into capital outlay as far as the Department of Health is concerned. In fact, a lot of our friends in the Department of Health are really frustrated kung bakit walang capital outlay for 2021 when we even have a pandemic. So it's a matter of priority. Ano bang priority natin? Health o itong ibang mga programa? I think health is very important. And while it is true that we are constrained by the budget, but my question is, how much would it really take for the government to build an Apex hospital? There are already existing hospitals. All we have to do is add facilities to that hospitals and then make them an Apex hospital. Hindi naman po ito, we are not starting from the bottom. We are not starting from the bottom. Kung hindi, we already have existing hospitals that all we have to do is expand the bed capacity, expand the capability, and make it an Apex hospital so that doctors, specialists who would rather not go to the provinces and stay in the highly urbanized communities would also be enticed to go to the provinces because there are good facilities, existing good facilities. So the intention is not really, it will not really take so much money. That's why I would like to ask the Department of Health, Madam Chair, kung magkano talagang kailangan to establish an Apex hospital if you have to start from scratch, or all you have to do is just improve the existing hospitals.
Sir Rod Napulan, do you have any idea how much would it cost to establish an Apex hospital? If you can
Thank you,
explain
Madam
first,
Chair.
Sir Rod, can you explain first what is an Apex hospital for the benefit of everyone?
Thank you, Madam Chair, and thank you for this for the support for this bill. Yes, Madam Chair. The Apex Hospital, as identified in the Department Memorandum of Department of Health, dated October 14, 2020. Actually, this was recently issued out by the DOH, pursuant to the Administrative Order 2020-0019. Ito po yung guidelines on the service delivery design of the healthcare provider networks. So what we're envisioning is that we have this Apex hospital that would be as the end referral hospital with a specialty capability. Specifically, itong Apex or end referral hospital shall have the ability and commitment to provide performance mentoring. So sila po yung magtuturo dun sa mga lower facilities in terms of how they will improve the services as well as for the patient care, and to provide technical assistance to the healthcare provider network. So it's not only about the facility but as well as the network per se. Kasi yun po yung envision natin that the health facilities are connecting each other to maximize and optimize the resources. And to ensure also the quality, efficiency, and the patient-centered clinical services, they have also this teaching and training capabilities, and as well as to ensure the functionality of the referral system. For both the clinical, public health, and then operations research, meron ganun din po siyang mandates. So parang holistic po yung magiging mandate po ng Apex Hospital, not only to lead but as well as to conduct research and mentoring and technical support to the lower facilities. So right now, ang DOH already identified several hospitals, both government and private hospitals. In fact, there are already around 54 Apex hospitals identified based on the department memorandum issued by the DOH. So meron pong specialty hospital, so automatic po yun. May mga batas po na specialty hospital, yun po yung single specialty hospital po natin. in Metro Manila. So 10 po yun lahat sila, such as the Philippine Heart Center, the Lung Center of the Philippines, the National Kidney and Transplant Institute, yung Philippine Children's Medical Center, as well as po yung mga RITM, San Lazaro, Children's Hospital, Fabella, Orthopedic, and then Mental Health, National Center for Mental Health. And then we have already 28 level 3 general hospitals na identified din also across the country. Na-distribute po yan based on their regional mandates siya. Except lang po doon sa mention po kanina na may 4 po na regions na wala pong level 3 hospitals. So yun po yung recommendation po sana namin. We will further improve these 4 regions. Unfortunately, Madam Chair, kahit ang isang concern din po kasi namin, when we analyze the situations of the 3 regions, like for instance, yung BARM, yung Caraga, and then the Mimaropa, ito po yung walang level 3 DOH hospitals. Kasi yung isang concern po talaga is the human resources. So yung mga specialista at saka yung mga healthcare human resources po natin ay hindi kulang po sa area. In fact, most of these hospitals, although may ginagrant yung DBM na positions, but unfortunately, kulang po yung applicants. So, ang hirap pong maghanap po ng mga specialista to comply with the level 3 na requirements po ng DOH po.
Sir,
so, yun
Lord,
po yung
if you can answer the query of our Deputy Speaker, on do you have any at least ball figure on establishing an Apex hospital or referral hospital?
Sorry, Madam Chair. Relative naman, Madam Chair, for the operation cost requirements for the level 3 hospitals, so kahit yung pinakamababa po na bed capacity po natin for level 3, dapat more or less nasa 250 beds based on our standard. So with this, yung PS, yung personnel services po nito, umaabot sa 450 million annually. Yung maintenance and other operating expenses po niya ay nasa 340.362 million. Annual din po yun kasi recurrent po yung operations. While for the equipment, hindi pa po kasama dito yung mga highly specialized and sophisticated equipment, nasa around 340 million. And requirement for infrastructure naman po niya is around 1.164 billion po. So more or less, Madam Chair, yung capital outlay requirements po nito nasa around 1.5 billion, almost 1.5 billion, while the recurrent annual operations niya, yung PS as well as ang MOE, ay umaabot din po sa around almost 800 million po. So more or less, ang total po na requirements around more or less mga 2.3 billion po.
Okay.
Okay. That is, Madam Chair, that is when you start from ground zero. But since there are already existing hospitals in the area, all you have to do is just enhance it. So how much will it cost?
So based on our standard, Madam Chair, because titignan din po namin kasi not only for upgrading but as well as consideration na kanina sa human resources as well as yung availability ng current capacity niya. Like for instance, sir, for the Caraga, so yung Caraga Regional Hospital is a level 2 hospital pa right now, although the mandate is already level 3. But unfortunately nga po, because of the human resources, kulang ng specialista, wala din po napupunta na specialista dun sa area. Right now, ang hospital, sabihin natin na 800 million po yung current na assets po niya. So kung i-upgrade po natin, makulang-kulang po sa 1 billion din po yung requirements to fully upgrade siya sa level 3 for its capital outlay requirement po niya.
But it doesn't mean that if it is level 3, it is already an Apex hospital, no? It doesn't mean.
It doesn't mean, sir. Yeah.
Okay, now, my question. In Mindanao, how many Apex hospital do we have?
Sorry. In Mindanao, Madam Chair and Congressman Pichay, right now we have 1, 2, 3, 4, 5. Around 5 hospitals identified as the Apex Hospital.
So where are the hospitals located?
They are, sir, Zamboanga City and Zamboanga City Medical Center. We have the Northern Mindanao Medical Center. It's in the Cagayan de Oro. The Davao Regional Medical Center in Tagum City. Southern Philippines Medical Center in Davao City. Cotabato Regional and Medical Center po nasa Cotabato City po siya. And meron pong private hospitals na identified as the Apex in Davao City na isa po. So that's, that's the Davao Doctors Hospital.
So that is the sad state of our health program in Mindanao, right?
We fully agree, sir, that we need to further improve and expand, sir, the capabilities of these hospitals, not only the UH hospitals as well as the private and local government hospitals.
Sir Rod, DS, if I may interject lang po. Sir Rod, you mentioned there are 5 considered Apex Hospital in Mindanao.
Yes, Madam Chair.
Yes, but currently, are they operating as an Apex Hospital talaga? Or ito yung na-identify lang ninyo and ipiprepare pa lang siya, kakapacitate nyo pa lang siya to become an Apex Hospital, right?
Actually, Madam Chair, they are already identified based on our maturity index po. So parang ito po yung mga hospitals kasi we required hospitals to submit the maturity level compliance po nila as to the Apex hospital. Ito po yung mga na-consider po. And they are already complying right now po, sir. So actually, nakapag-comply na po sila, Madam Chair. So technically,
okay,
Madam Chair, these hospitals already operate specialty.
Okay, that's good. Okay, sige. Do we have comment pa from Kong Aglipay, our principal sponsor? So I can recognize representative from PMA. Do we have Kong Michael? Ma'am Sylvia? Do we still have Kong Michael? Okay, while waiting.
We're still looking. Yes, ma'am. We're still looking po.
While waiting, I would like to recognize representative from PMA, Dr. Atienza, the president.
Good morning po.
Yes, go ahead, Dr. Atienza.
We concur with the PHA President, Dr. Almora, and we would like to thank for considering the PMA one of the member of the TW, and PMA supports the upgrading and modernization of the regional hospital as the APIC hospital for the region. In fact po, I saw the improvement of Batangas Provincial Hospital became the regional hospital, now the Apex Hospital. Malaki pong naging tulong ng Batangas Apex Hospital to our community kasi especially in the training of the residents, nasa level 3 po sila. And as of now po, ang ating po mga residente po doon sa Batangas Medical Center is being dispersed po as part of their dispersal sa different district hospital. Sila po ay nag-umpisa noon at different hospitals in Batangas po, nandoon na sila, even in areas of Mimaropa. And we saw the improvement po from their facilities, and it's a great improvement. And the final position po of the Philippine Medical Association for this bill will be formalized po by PMA Legislation Committee, and we congratulate po our chair for this endeavor. Napakaganda po kasi maano po natin, most of our PMA member po ay nag-forward po sa government, and and this there are 4,000 na nag-take po ng board exam. We will invite po namin para ma-encourage pa sila na magpunta po sa training ng government hospital. And we allowed po the DOH po and for the funding for this project po. It's a great from the Philippine Medical Association po. Maraming po salamat.
Okay, thank you so much, Dr. Atienza, PMA President. May I call on Kong Ging Swansing for the approval of this.
Madam Chair, before we approve.
Yes, Kong Umali.
Yes.
Sir.
Madam Chair, I agree. Maganda yung laudable yung Apex Hospitals. But unfortunately, I agree also that the observation of Yusek Echeverry na hindi lahat ready. And I know that kasi I've been governor before I became congressman and then governor and then now back to Congress. And siguro pwede ba nating is it possible na ipagano natin tama yung yung question, magkano ba talaga magagastos? Tama yung kay Kong Butch, Pichay, no? Tapos kung magkano, kung hindi kaya, pwede ba na bigyan natin ng priority yung mga yung mga ready na para at least matuloy lang. Kasi kung hindi kaya, wala na namang mangyayari rito sa ating mga sa bill na ito. Even if we pass it, hindi natin na i-implement ito because of lack of budget. So if ever, kung mag-prioritize tayo, alin ba yung mga ready na? Kasi meron mga governor sa totoo lang na hindi naman nila priority yung health eh. Sa totoo lang. I've been president of the Governors League and ULAP and nakita ko yung mga ibang regions, yung mga ibang governors hindi naman ganun ka-ready talaga. Hindi nga nila pina-prioritize yung health. So, kailangan reality check tayo. Ano ba talaga? Yung handa, pagsabay sa natin, tingnan natin kung alin yung mga pwede nating ipa-implement na. At yun muna yung Pero ipasa natin. Okay lang na ipasa. Pero let's prioritize kung alin yung mga regions na pwede natin gawa. Thank you po.
Thank you, Kong Umali, for that inputs, no? Isa lang siguro din na kailangan natin itanong sa ating authors. Are we intending to expand only those regional hospitals run by the DOH? Should we include the provincial hospitals? Because yesterday, I had that conversation with the speaker and he asked me if I can conduct a consultative meetings with the provincial governors and the Department of Health and DBM for the renationalization of all provincial hospitals, no? So nasabi ko po sa kanya based on my experience as chair of the Committee on Health, meron tayong mga filed bills of the representatives renationalizing the provincial hospital, but the provincial government will not support that proposal. So, ang suggestion ko sa kanya is to get muna inputs from the ground before pushing for that legislation. So, kung DS Butch, ang intention ng bill po ninyo is expanding, upgrading of a regional hospitals and establishing a regional hospitals na APEX, no?
Yes.
Multi-specialty in areas na walang existing, right, sir?
Yeah. Well, the intention is this is an hospitals run by the Department of Health. So mostly regional hospitals. However, the statement of Congressman Umali is also worth looking into because there are first-class provinces. And first-class provinces can really afford to establish apex hospitals. It depends on the political will of the governor. Tama yung sinabi ni Congressman Umali. May mga governor dyan na kahit first-class province yung kanila, they do not establish apex hospitals because that is probably not the most important thing in their program as far as services to the people. But there are also provinces na talagang third class, they cannot really afford to establish an apex hospital. Kahit yung district hospital nga, hirap na hirap. However, the Department of Health subsidizes these hospitals. So may mga subsidy yan. And not only that, if you manage it properly, alam mo naman ngayon, may PhilHealth, no? And if PhilHealth will manage the resources properly, and then the governors would have the political will to improve the district hospitals, may revenue naman po ang mga district hospitals. May revenue din po ang mga regional hospitals natin or national hospitals. I think this would be a lengthy discussion because we really have to balance. There are like Pangasinan. If you visit the province of Pangasinan, when Governor Spine was the governor, he really improved all the hospitals in Pangasinan. I think that is a model for a first-class province na talagang pinaganda niya yung mga hospitals doon. Lahat ng district hospital, yung provincial hospital, if you go there, it's really fantastic, no? Depends sa political will ng governor yan. And if we really want a standard health services, I think there should be, as far as DILG is concerned, there should be a certain budget really intended for hospitals in every LGU. So, ibang usapan naman ito. Usapang LGU ito. But honestly, right now, the Department of Health is already subsidizing some district hospitals and some community hospitals. So, siguro, Chairman, that would be a subject of another discussion. But right now, I think there's a need for us to fast-track the passage of this bill, the Apex Hospital, because if really we have that political will to serve our people as far as health services is concerned, then we really have to fast-track the passage of this bill.
Thank you so
Hello,
much.
ma'am.
Yes,
Hello, ma'am.
yes, Kong Michael. You're
Hello,
back.
ma'am.
Yes, sir. Your
Yes.
final comment. I don't know
Yes.
if you hear the discussion.
Yes, ma'am.
On the proposed
Yes,
bill.
ma'am.
So,
Yes,
last comment, sir.
Yes, I apologize. The signal was bad while I was on the road. I heard the part of the discussion, and this bill, the purpose of this bill is to establish new 10 to 15 regional health hospitals that are par with the likes of Manila Doctors or Capital Medical Center that would require at least 8 billion pesos per hospital from the equipment, from the building, the facilities, and it will be manned by specialists like oncologists, internists, and the proposal that we do upgrade the provincial hospitals, I think it is not doable because the DOH already has a bad what do you call this? Bad track record of upgrading hospitals and upgrading it from, for example, 50 beds to 100 beds. That's why in my bill, I propose a hospital commission composed of not only the DOH but private sector, because that is the best way to have inputs of the private sector to mobilize this as fast as possible. Because in countries such as Vietnam and Thailand and Indonesia, like ours, who is our archipelago, they have regional health centers that are at par with the private. That is what we are lacking as a ASEAN economy. So I hope that we can expedite this and give the necessary budget, which is the most important part of this bill. Thank you, Madam Chair.
Kong Michael, we were discussing earlier, sir, kasi of the intention of the bill of DS Butch and yours, no, and the proposal of the DOH. Kaya kinlarify ko, sir, kay DS Butch, okay sa kanya yung upgrade of existing regional hospitals into Apex Hospital and establishment to those areas na wala pong existing. Like na-mention kanina, Mimaropa has level 1 in, I think, in Palawan, pero wala po silang regional hospitals or Apex hospitals, which means we'll start with prioritization, no? And then ang comment po ng DILG on the budget component, natin, no, na-discuss kanina. So we have to be realistic
Yes, sir. Yes, ma'am.
Feasibility of implementing this if enacted into law. So as I mentioned earlier po, kanina, aligned with the Universal Healthcare Law, ito din po yung vision niya na in the long run, yung na-map, no? Pinapa-geomap po natin ang sa buong Pilipinas, nasaan yung mga kailangan na hospital at yun ang ipaprioritize sa funding ng DOH. So ang question, sir, if you're amenable to consolidate it with Kong Pichay's bill so that we can approve it in principle subject to style and amendment. So we'll coordinate closely with you, the committee and the Department of Health, sir, and DBM.
Yes, ma'am. I know that there are budget constraints. I am amenable to consolidate the bill with the DS Pichay. My only concern is dapat standard yung across the board from Luzon, Visayas, Mindanao, yung laman ng hospital at saka yung doctors na makikita po natin doon na specialist. Hindi po yung dahil nasa Visayas siya, nasa Mindanao, lublog na lugar, mas konting doktor or mas hindi trained or mas konting ultrasound or mas konting mga machines. Yun lang po ang concern ko. But in principle po, I agree po to consolidate.
Thank you, sir. So may I call on Representative Ging Swansing?
Yes, Madam Chair. This is consistent to the aspirations and the intent of the Universal Health Law, which you worked hard for it. So I move for the approval of House Bill number 269 and 269, authored by Representative Michael Aglipay, and House Bill 6857, authored by my favorite DS Congressman Pichay, subject to style and amendments and consultation if necessary, Madam Chair. So move.
Second. I second.
There's a motion to consolidate House Bills 269 and 6857, subject to style and amendment and consultation if needed. Duly seconded. Is there any objection? Hearing none, then the motion is approved. Congratulations, DS.
Congratulations,
Michael.
Congratulations.
Next.
Madam Chair,
Yes,
I think
yes.
I would like to move that we form a technical working group as far as the consolidation is concerned. I so move, Madam Chair.
Okay, sir. Thank you. Thank you, sir. Anong kasunod natin? Okay, DS Butch.
Yes, ma'am.
Because the proposal of Representative Ging is to consolidate the bill and approve in principle, no po? So we actually did not create a technical working group, but more of we'll be having a small group consultation with authors at DOH at DBM and the ILG, sir.
Okay, thank you, Madam Chairman.
Thank you, sir. Thank you so much.
And congratulations.
Thank you po. Okay, we'll now proceed to the approval of the substitute bill on House Bill number 6995. May I call on Representative, our Vice Chair, Sean Acop, to chair, to give way for the presentation of my proposal. Do we have Representative Acop?
Thank you, Mr. Chair, Madam Chair. May I now ask our Chairperson, Representative Helen Tan, to present her bill, House Bill number 6995, on the Health Procurement and Stockpiling Act.
Thank you, Madam Chair. Good morning again, everyone. I will now present the unnumbered substitute bill on Health Procurement and Stockpiling Act. For the past months, the Committee on Health has been preoccupied with deliberations on a series of health reform legislations, which are products of our realizations from the COVID-19 pandemic, such as the National Health Security Bill and Medical Reserve Corps Bill, which were approved last committee hearing. Today, I will be presenting the substitute bill on Health Procurement and Stockpiling Act, one of the important legislative measures we seek for approval this 18th Congress. Lest we forget, let me remind you that not so long ago, the country experienced shortage of essential medical supplies and necessary materials to combat COVID-19 pandemic, such as masks, personal protective equipments, alcohol, mechanical ventilators, and RT-PCR test kits and machines. At that time, we relied heavily on donations, and the entire country panicked as there was global shortage on these items as well. To avoid a similar situation, I have filed this bill with the main thrust of protecting the public health and safety by preventing and controlling the spread of diseases and other health hazards through the stockpiling of essential and critical drugs and medicines, vaccines, devices, and materials to effectively and swiftly confront the devastating consequences of public health emergencies. As defined in the bill, stockpiling refers to the inventory of health commodities and materials, or those physically reserved of definite quantities of commodities or materials that are stored in the government warehouses or on government-owned properties that are intended for all essential health uses in times of emergencies. To operationalize such policy, this bill seeks to create a Health Procurement and Stockpiling Bureau, a body under the Department of Health. It shall serve as the principal agency mandated to undertake transparent, fair, proactive, and innovative procurement service for the DOH and to stockpile, conserve, and facilitate the release of adequate amounts of potentially life-saving pharmaceuticals, vaccines, devices, and materials in times of public health emergencies. As a consequence of such, the Bureau shall absorb the procurement service and the supply chain management service of the Department of Health. As provided under Section 6 of this bill, the Bureau shall formulate plans, policies, and programs on procurement management, undertake the procurement process, advise the Secretary of Health on matters pertaining to the procurement of goods and services, infrastructure and consultancy services, manage the Bureau's response activities during a public health emergency, identify strategic and critical drugs and medicines, vaccines, devices, and materials needed for such emergency, serve as a national supplement of drugs and medicines, vaccines, devices, and materials, ensure rotation, replenishment, and freshness of stocks, and that there exists at all times steady, available and adequate supply of drugs and medicines, vaccines, devices, and materials, which are essential in responding to the public health emergencies. Facilitate the provision of potentially life-saving pharmaceuticals, vaccines, devices, and materials in times of public health emergencies. Act as a supply chain manager in the stockpiling of strategic and critical drugs and medicines, vaccines, devices, and materials. Acquire and release drugs and medicines, vaccines, devices, and materials as directed by the Secretary of Health in the interest of the public in response or in preparation of any conceived public health emergency. Dispose drugs and medicines, vaccines, devices, and materials as required for purposes of addressing the public health emergencies. Require all suppliers to monitor their stocks and production capacity and notify supply disruptions at least 6 months in advance. Regular analysis and communication of impending shortages ahead of time. Facilitate the creation of a conducive environment to encourage pharmaceutical and device self-sufficiency for medical supplies needed by the country by forging public-private collaborations with institutions, sectors, and the industry, which could bolster government efforts to achieve pharmaceutical and device self-sufficiency. Make an in-depth study of drugs and medicines, vaccines, devices, and material supply shortage in the country. Maintain a publicly accessible inventory database of the available commodities and stocks of all items included in the proposed stockpile, including the date of expiry of relevant stocks and their purchase prices, and spearhead the crafting of the multi-sectoral national drug and device security program geared towards the country's self-reliance in producing drugs and medicines, vaccines, devices, and materials. Drugs and medicines, vaccines, devices, and materials to be stockpiled may be obtained from the domestic or foreign sources, and the procurement thereof shall be open to all eligible suppliers, manufacturers, and distributors. However, the Bureau shall encourage the development of domestic sources to ensure steady, available, and adequate supply by purchasing strategic and critical drugs and medicines, vaccines, devices, and materials of domestic origin when such are needed for the stockpile. Contracting with domestic facilities for processing or refining of strategic and critical drugs and medicines, vaccines, devices, and materials in the stockpile, identifying existing domestic facilities and domestically produced strategic and critical drugs, medicines, vaccines, devices, and materials to meet the requirements of the public health and essential civilian industries in times of public health emergency when existing domestic sources of supply are either insufficient or vulnerable to a single point of failure, and contracting with domestic facilities to recycle strategic and critical devices and materials. There shall also be a medical stockpiling fund to support the National Drug and Device Security Program, which will be managed by the DOH. The Department of Health may also solicit and receive donations which shall form part of the fund and subject to quarterly reporting of its receipt, expenditure, or disbursement. Likewise, fundraising activities may be conducted by the DOH and the proceeds of which shall accrue to the fund. Lastly, in order to maintain transparency in the implementation of this act, the DOH shall submit an annual report to the Congress of the Philippines detailing its operations under this act, which shall include information with respect to foreign and domestic purchases of stockpiled drugs and medicines, vaccines, devices, and materials, the acquisition and disposal of stockpiled drugs and medicines, vaccines, devices, and materials, and such other pertinent information. After having received the position of various stakeholders and after careful deliberation and consideration of this bill, we submit before you the substitute bill on the Health Procurement and Stockpiling Act and humbly seek everyone's support for the approval of this equally important piece of legislation. Maraming salamat po, Madam Chair.
Thank you, Madam Chairperson. May we hear from Congresswoman Janet Garin, who would want to ask some questions?
Thank you very much, Madam Chair. Of course, allow me to congratulate the author of the proposed measure. I do agree that the intention is good. However, I have a lot of questions since we will be dealing not only with donated funds, but I presume government funds for this matter, as well as the accompanying accountability. So my first question is, Madam Chair, Honorable colleague, will this not be a redundant office? Because if we discuss about health procurement, warehousing, distribution, and stockpiling, these are supposedly existing offices within the bureaucracy of the Department of Health. And if I may, Madam Chair, I can just go to the next two questions so that we can have an alignment in answering. The next question is, how about the expiry dates? Because when we talk about the regular procurement, not related to outbreaks and epidemics, even if it's related to outbreak and epidemics, there are actually mandated, like for medicines and vaccines, I'm not sure, but sometimes they would mandate at least 8 months delivery, with a delivery date of the 8 months prior to expiry, sometimes 6 months prior to expiry. So how are we going to deal with this? Because when pandemic struck us, it would struck us at a time that we are not aware of it. So I don't know how can we reconcile the stockpiling and the Asian pandemic. Third is, you did mention the Asian PPEs, that is good. However, there is a global allocation. Remember when we had Ebola, even if our government wanted to buy, the global world dictates upon us that we cannot buy. And the suppliers and the manufacturers are dictated by the world that they can only supply to countries affected. And then next would be the accountability. What would be the accountability of the officers and employees and the officials involved in the procurement and stockpiling division, simply because COA might look at this as a waste of funds. So how can we reconcile both?
As to the first question on the duplications of functions, in the provision, we mentioned that the existing Procurement and Supply Chain Bureau of the Department of Health will be subsumed. No? So, malinaw po doon sa sinabi natin na siya ay still attached to the DOH, but will be subsumed under this proposed bill. On the function, on the expiry issue, very clear po kanina on the functions I mentioned on how do we prevent, no? So, ilagay po natin that the Bureau will ensure that the stocks are fresh, no? And that 6 months before the expiration ay nakikita nila. So, I think po yung details on how to implement, no, and prevent those expiration of stocks will be written in the IRR, no, yung mechanisms natin. Pero malinaw din po dito in-address natin because we are aware of the current problems of the DOH na may mga na-expire na medicine, and doon din nakita natin that we really need to strengthen yung kanilang process and systems within the Procurement and Supply Chain Management Bureau. On the accountability, we didn't mention or provide the penal provision kasi naman under the existing laws natin or doon sa responsibilities of our government employees, po pwede namang gamitin yon. So, accountable naman sila. But if the Honorable Deputy Senior Minority Leader ay merong recommendation so that we can hold responsible then our designated attached agency, pwede naman tayong maglagay. So, lagi naman po talagang merong responsibilities ang ating mga kawani ng gobyerno pagdating doon sa functions nila.
Thank you very much, Madam Chair. If I may push forward some follow-up questions. Yung worry ko po sa accountability, I know they are already accountable by virtue of the positions that they hold. But the dilemma that I am possibly looking at there is yun nga, yung accountability nila. Kasi pagdating sa COA, yung value for money, matatamaan yung mga bumili tapos makikita na hindi ginamit. Hindi kasi like even with the expiry date, let's say when we bought a lot for bird flu or kung may H1N1, mag-preposition tayo ng tummy flu, hindi mo rin naman kasi siya pwedeng gamitin sa ibang sakit. So, paano po yun? Para baka mamaya sabihin sila, o bumili kayo, hindi naman nagamit, maitatapon lang. And how about the COA findings? Magiging kawawa po kasi ang mga kawani ng Departamento ng Kalusugan if the accountability is on them. Now, on the expiry dates, that's my point. Kasi pag mag-struck ang isang pandemya, that's why we stockpile for a pandemic. For baka naman hindi po kasi natin nalalaman yun 6 months or 8 months before. And if let's say the officers in the proposed bureau will not be able to buy, baka sila naman ang sisihin. But the problem is they really cannot buy because if you are not a country that is affected, the World Health Organization and the global market, the global world will dictate on which country can buy. Yes, they will be subsumed. But my question is, dun kasi sa procurement, halos na-involve lahat ng USEX, ASEX, and director. I think it's because there are certain qualifiers in government. Like for a back chair, you have to be this position, salary grade. Ay, nakalimutan ko lang pero parang may mga ganyan. Pagka naman member ka ng back, meron ding minimum requirement or position. Kaya halos lahat dyan na-involve and then nirurotate sila. So my question there is the redundancy that I am referring to. If we just put them in a specific task, they cannot perform their tasks as ASEX and USEX of the other areas where DOH is really needed. I believe the biggest problem that we are having here, once there is global shortage, it will affect really the whole world. Kasi kung areas na ang affected, dun lang yung binibigay. I think one of the greatest dilemma that we have to really respond to, kasi dito nangyayari yung sa procurement, when can a procurement be delegated or not? Because let's say if you have the Health Procurement and Stockpiling Bureau, but then they authorize, let's say, a certain hospital or a newly created BAC or other government agencies, dun kasi walang clear-cut na delineation. Kailan mo ba pwedeng ipabili sa PITC, let's say sa ibang mga ahensya, kailan ka ba pwedeng mag-create ng special BAC? And what we notice is that there's regular rotation to avoid familiarity. So these are the problems that I am seeing that should be resolved because sayang naman yung batas na ipapasa natin if it would mean like additional people, additional manpower, and then it cannot function because DOH will not have additional funds for hiring of the certain qualifiers. I'm not sure. I think ASEC, USEC position yung minimum for you to be a member of the procurement agency. And how do we align it with the commission and audit? Kasi what we notice, pagka merong nag-expire, pagka merong hindi nagamit, value for money kaagad ang gagawing reason. And then cases will be piling against them. So we don't want to distract our doctors. I believe ang medyo kailangan mas talagang tutukan is the warehousing aspect. And what would be the accountability, let's say, of the Secretary of Health? Na kunyari, meron kang warehouse. Warehouse should be manned by warehousing people or logistics people. But what happens is, ikot ng tao, meron tayong mga good doctors who will be thrown into the warehouses. Sayang ngayon yung kanilang pinag-aaralan. So, ano yung qualifications? Sino ang, kasi as I saw the proposal, correct me if I'm wrong, but I could have misunderstood it. There's also the power of the Secretary of Health to just assign whoever is within the department. So ngayon, kunyari, meron kang magaling na doktor or meron kang magaling na program director, minsan inintriga, tinapon mo sa Stockpiling Bureau, what would be the accountability now of the Secretary of Health for assigning people who are not aligned to these tasks? Baka kasi magkaroon ulit ng bureau na may reason na, doon mo na lang yan i-floating mo. That's, I know the intention of the proposed measure is very good, but I am somehow afraid of the possible consequences which will redound to the inoperability of the proposed measure, coupled with the fact that this might incite fear among those who will be held accountable. Remember, with the prepositioning of items for bird flu, hanggang ngayon hindi ba sagot-sagot yung binabato ng COA na findings. Not only that, there are also some, let's say if you buy a commodity and the expiry is, let's say, 6 months, hindi mo kasi siya pwedeng ilabas because when you buy it, andun yung purpose. Kung ilabas mo na hindi yun yung purpose, mapapasok ka naman ng technical malversation. Kung ilabas mo naman na hindi mo maubos, papalo naman na parang waste of government funds. So how do we balance this? Unless it will be an office that will be solely dedicated, handling donated and funds generated from fundraising activities. Thank you, Madam Chair. Thank you, distinguished colleague.
Thank you, Madam Chair. Thank you, Kong Janet. I think ang observation of our Honorable Congresswoman is based on her experience as Secretary of Health, and it's more of on the operation. Kung kaya po in the proposed bill, ay nagtatalaga tayo ng National Drug and Device Security Program. Malinaw naman po na inilagay natin yung mga functions that the Bureau should do, no? At how to operationalize each of the functions will be reflected, I think, on the IRR of this bill. With the issues on, again, on the accountability, I don't know if it's proper that we put specific penal provision kung kailan magiging responsible ang members of the Bureau and the Secretary of Health, or we can just rely on the existing yung malversation and misappropriation grounds for government employees, no? Ang sinasabi niyo po kasi doon sa pagdating sa positions like nagro-rotate because of the familiarity, no, ng ating mga ASEC and USECs. Ang gusto natin this time, kung magkaroon po ng bureau na isasubsume natin yung existing, and we have that management team siguro, and ma-implement nila efficiently and effectively kung ma-enact ito into law. Kasi nakita rin natin, pagpalit po ng USEC or ASEC, affects also the implementation of the program, no? So, marami na tayong nakitang ganyang problema sa gobyerno. Although, valid yung sinasabing familiarity because of that, sinasabi nyo on the, like yung mga back chair or sa bidding process, yung umuupo ng mga tao dito. But this one kasi is more of, yung ine-stockpile natin naman ay mga gamot na kakailanganin natin sa panahon na darating yung public health emergencies. And kaya ginagawa natin ito, ini-strengthen natin itong bureau is because gusto natin na magawa nila yung hindi nagawa dito sa pagdating ng pandemya, no? So inilagay natin, kaya kanina I mentioned napakadaming functions na dapat ma-ensure based on the observations natin or experience natin nitong COVID-19 pandemic. So kung may suggestion ang ating kaibigan on nakulang na provision just to ensure na that this proposed bill will be implemented effectively, we welcome that proposal kasi mas may experience siya when it comes doon sa internal operations of the Department of Health, no? So, yun po, Madam Chair. Madam Chair, if we can hear lang po comments from the Bureau of Procurement from the DOH.
May we hear any comments from the Department of Health regarding the procurement? Any representative from the DOH? Maybe any comment from the DOH?
Good morning po, I'm Director Valdez po. So in general po, the procurement service endorses the proposed bill. However, amendment to number 6 po on the functions and responsibilities of the proposed bureau, the following functions may be done better by existing DOH agencies or other departments, or can be properly interfaced or coordinated only by the proposed bureau. These are for the following in the substitute bill: monitoring supplier stocks and production capacity, facilitate creation of conducive environment to encourage pharmaceutical and device self-sufficiency. You may make an in-depth study on drug and medicine, vaccine, devices, and material supply shortage in the country. And S, spearhead the crafting of a multi-sectoral national drug and device security program. So we have po a pharmaceutical division on under the health regulation cluster of DOH, which essentially has the following responsibilities. So this was created po under Republic Act 9502. Or the Cheaper Medicine Act. So these are for their, of course, their function is limited to drugs and medicine. So their functions essentially are improve the supply and access to quality essential medicines, ensure rational use of medicine by prescribers, dispenser, and patient, institutionalize transparency and good governance in pricing and procurement of medicine, and ensure adequate health system support for the implementation of RA 9502. So there's such an office also in the Department of Health. So it's the functions mo that I mentioned should not, if and when the new bureau will be created, should not be a major function of that bureau. So number 2, in other departments, we also have the Board of Investment of the DTI, which is into industry development and in investment promotion. So yun lang po, so far, those are the major comments that we have at this time on the proposed substitute bill. Thank you po.
Any other comments from the other resource persons?
Yes.
Maybe.
Yes, good morning. Good morning, Honorable Chair and the Honorable members of the committee. The FDA submitted yesterday the position paper on House Bill 6995. May I please allow me to read the position paper. The Food and Drug Administration fully supports the House Bill 6995, which shall be known as the Health Procurement and Stockpiling Act. The FDA would like to suggest the modification of the following terms under Section 3, the definition of terms. Letter A, for the purpose of implementing this act, the following terms are hereby defined. Letter A, counter trade, refers to a supplemental trade tool in connection with a transaction involving the importation or procurement of foreign capital equipment, machinery, products, goods, and services. As further defined by Executive Order Number 120, Series of 1993, enacted on August 19, 1993, which established the national policy on counter-trade in the Philippines, it shall refer to any of the following arrangement. Letter A, counter-purchase, also known as counter-export, parallel transaction or reciprocal trade, whereby the foreign supplier reciprocally commits to purchase Philippine goods or services to be exported to the supplier's country or third country. Letter B, product buyback, whereby the foreign supplier of the equipment or machinery is paid for with the resultant products or goods made or manufactured by such equipment or machinery. Letter C, offset, whereby the foreign supplier commits to introduce investment or technology transfer in the Philippines or assist in the establishing new industries or improving existing industries to generate or save foreign exchange or create increased employment, which may or may not related to the machinery, equipment, products, or goods imported or services procured. Letter D, trade to debt swap, whereby a loan or credit accommodation obtained by a government agency or government-owned or controlled corporation from a foreign government or creditor which has remained outstanding and unpaid is arranged to be settled in full or partially by way of sales of products, goods, or services to be provided by a third party rather than by payment in foreign currency. Or letter E, any form of combination or variation of the above arrangement that results in the inflow of the country or foreign exchange or saving thereof, investment, training, and technology transfer, grant for education, scientific, technological, environment, and related research program or projects, which will enhance Philippine industrial or export competitiveness or contribute to the creation of new competitive industries, enhance existing industries or utilization of Philippine services, or by expertise by foreign clients, or in the reduction of foreign debt. And at the same time, Madam Chair and Honorable Member, we want to include the additional definition for the devices. Devices means instrument, apparatus, contrivances, including their components, parts, and accessories that are authorized by the Food and Drug Administration, intended for use in the diagnosis, cure, mitigation, treatment, and prevention of disease in man. So we want to suggest or recommend inclusion of the phrase authorized by the Food and Drug Administration, and to delete the provision, treatment and prevention for animals. And number 2, or to affect the structure or any function of the body of man, also to delete the word animals. And letter C, for the definition of drugs. Drugs and medicines refer to any chemical compound, biological substances, other than food, that are authorized by the Food and Drug Administration. And lastly, we want to recommend under Section 6 of House Bill 6995, Functions and Responsibility. It is suggested to add the following: ensure adequate provision of recommended and proper storage, containment, or transport conditions such as the room temperature and humidity, refrigeration, or freezing condition, including provision to keep the products away from heat, sunlight, rain, and moisture. That's all po, Madam Chair. Thank you.
Thank you very much for the comments of FDA, Ms. Pedron.
Madam Chair. Yes, po. Thank you so much. As an author of this bill, I am amenable to adopt the proposal of the FDA they were given enough time to submit their position, pero kahapon lang po daw sila as per committee secretariat submitted. So that's the reason why we weren't able to include that proposal in this substitute bill. So I'm willing to adopt the proposal on of the FDA, Madam Chair.
Thank you, Honorable Chair.
Madam Chair.
Yes, Yusek Dino.
Thank you, Madam Chair, for recognizing me. Anyway, we are fully support the bill. No? This time, masasagot na natin yung mga katanungan sa barangay. Most especially, ako po ang Undersecretary for Barangay Affairs at saka meron po tayo na 840,000 na barangay health worker. Na at the end of the day, lahat ng mga proyekto ng Department of Health ay ibinababa ninyo sa mga barangay. Kaya nga po napakaganda nitong proposal na to dahil ngayon we will make sure na yung ating mga pinapurchase na medicine na mapoproteksyonan ng Department of Health dahil yung nababalita natin na yung mga gamot ay na-expired na samantalang kailangan lalong-lalo na po sa probinsya. At sana makita din natin na kung pwede, hindi lang sa Department of Health main office naka-stockpile yan, kung naka-deploy na po sana yan sa ating mga region. Tapos kanina nga may na-discuss tayo yung magpaglalagay ng regional hospital, provincial hospital, para naman malapit na po pagkailangan sa barangay. Tapos siguro mag-invest na din tayo na kung paano natin yung kamukha ng binabanggit kanina, yung refrigeration, kung paano natin mapapatagal ang buhay ng mga gamot na bibilhin ng Department of Health. Kasi ang matutulong po namin dito sa departamento ngayon po ay gumagawa na kami ng barangay profile system. Kasama po sa barangay profile system kung ano ang mga sakit doon sa aming mga barangay. That's why you can identify now kung anong gamot ang ilalagay nyo doon sa city, province, municipal, or region. Kung ano yung laging sakit na nangyayari doon. Ito po yung ginagawa namin na ngayon we will i-database namin lahat ng information sa barangay including the health situation in every barangay in the Philippines. So yun lang po ma'am. Thank you very much for the bill. And this time, at least alam na mapoproteksyon na dahil sa ginawa ng Senado. Yun pong mga nababalitangan na kung saan nasasayang po ang bilyon-bilyong halaga ng mga gamot na pinapurchase ng Department of Health. Thank you. Maraming salamat po.
Thank you, Yusek Dino. Point well taken kasi yan din ang observation ko na maraming nag-expire at saka kung minsan yung mga gamot na kailangan ng isang barangay is not what they really need. Point well taken, Yusek Dino. Now,
Madam Chair.
Yes, DS Prospero Pichay.
I would like to ask the proponent one question. Madam Chair, what exactly are strategic and critical drugs and medicines?
Madam Chair.
Madam Chair, yung minimension po natin dito na critical and
strategic
medicines will be identified by the public health emergency team, no, yung ating Department of Health, no. So depende po kung ano yung nakikita natin na possible na threat, no, sa ating health, at yun din po ang kanilang kaagaran na ihahanda. Although, like for example, ang pandemic, that's unpredictable, no? Hindi naman natin nakita talaga ang pagdating. Pero supposed to be, may panahon tayo paghahanda kasi hindi naman sa Pilipinas nagsimula ang COVID, no? So during the time, for example, what happened in COVID-19, panahon na nandun sa China, ang naging observation natin, talagang naging lax po ang DOH, no? Kasi parang hinihintay nating dumating. So, hindi tayo talaga naging handa. So, that's an example. So, dapat ngayon ay maging efficient sila, no? Proactive. So, kung magkaroon po tayo nitong i-strengthen natin itong Procurement and Supply Chain Management Bureau at nakapag-create tayo ng National Drug and Device Security Program, ay meron tayong team na naghahanda at nagtitingin palagi para sa ganon, pagdating ng panahon na katulad nito, may naka-proposition lang tayo na supplies, medicines, or vaccines. So, kung ano man yung kailangan natin.
Can I be recognized?
Madam Chair, naka-mute po kayo.
Can I be recognized po?
Yes, my good friend, our PMA President, Dr. Benny Atienza. Go ahead.
Proposal na po, sana magkaroon po tayo ng training of our health workers, lalo na po yung ating mga barangay health workers regarding sa cold chain. For the last 4 years po, inano na po namin yan sa FDA. Pinupost na po namin yan. Kasi po ang nagiging problema po natin, baka yung ipo po natin mga vaccines hindi na po umuubra kasi yung cold chain po nawala na. Kaya dapat po, di ba, may proposal po na bigyan ng mga health workers kahit bisikleta para yung cold chain ma-preserve, and dapat turuan po natin sila. As of now po, ang dami po natin mga health workers as a pediatrician, as advocate po ng vaccine. Ang dami po natin mga health workers nagko-combine po ng vaccine na hindi po dapat i-combine kasi iba-iba po yung preparation yan, iba-iba po companies, hindi po dapat i-combine yon. In fact, meron po tayong nababalitaan ngayon ating pneumococcal vaccine. Ako po, as a private practitioner, yung palang binili kong vaccine ay galing sa government na meron pong mga kumpanya, dapat po maano yan. Kasi kaya nagtataka po, pre-filled na po yung aming pneumococcal vaccine. Pero na-receive ko po doon sa kumpanya is yung pong separate, hindi pre-filled, na kahiwalay po yung syringe. Ibig sabihin po, pang-government po yon. Yung po, kasi ang dami po nasasayang na vaccine. At like po yung flu, darating po sa atin ang flu vaccine June, July. Pero expiration po noon ay December. Kasi in fact, dapat nating kasi as early as December, sa Europe po, sa Amerika, ibinibigay na po yan kasi doon po yung malamig na Pagdating po sa atin, paano natin gagamitin yung vaccine? Katulad po ngayon, bumabagsak ang presyo ng flu kasi mag-expire na ng December. Sana po maalagaan po yon. Then, like po ngayon, out of stock po ang doxycycline. Kahit po DOH, wala na. Di ba, every year po, nag-ano po tayo ng baha. Paano po tayo pupunta ng isa bang area? Kasi yun po ang mga kailangan natin. Yung preventive side ng leptospirosis, wala po tayong makuha. Kung saka po lang tayo magkaka-issue na kulang po yung drug, kung meron na pong naapekto ng leptospirosis, every year naman po bumabaha po dito sa Pilipinas. Yan po. Then, another thing po ay sana nga po yung sinabi kanina, yung provision sa penal provision, na yung pong makastigo po yung mga nagbebenta ng vaccines ng gobyerno na ibinibigay po. At sana po ang Philippine Medical Association po at mga doktor po, like ni pediatrician, tumutulong po kami ng pagbibigay ng bakunang libre basta manggaling po sa gobyerno kami po ang magba-vaccinate. Yun po, ang inaano lang po namin, sana yung scrupulous na practice na ibinebenta po, ang dami pong ganon. Even po yung mga barangay health workers natin, sinisingil ang mga pasyente kasi mo as a private po, nalalaman po namin yon. Matagal po na nangyayari yan. Yun lang po.
Madam Chair.
Yes, Madam Chairperson.
Thank you kay Dr. Benny Atienza for informing us on that na may nangyari na ganyan na ang vaccines na supposed to be supplied to the government, especially DOH, ay naibebenta. So nakakagulat din yung preparation. Because I was informed by the DOH that the suppliers of the pneumococcal vaccine was not able to deliver the specified amount. No? So maganda po sana, Dr. Benny, that you can give us at least a report sa Committee on Health so that we can call on the DOH and said suppliers to inquire what really happened, so that we can prevent na mangyari again ito. So maraming salamat po. Yung inyo pong observation on how are we going to implement. That's why we task po yung bureau talaga. Lahat ng detalye ay nilagay natin kasi nakita natin yung problema. Sila yung gagawa ng strategies nila on how to effectively implement those tasks. So, and how can we prevent yung mga expiration and yung sa cold chain natin is ito ay requirement naman. So kasama po yan sa preparations in the implementation of this bill if enacted into law. Maraming salamat po, Madam Chair.
Chair, Representative Estela Swansing.
Yes, we already discussed this extensively. May I move for the approval of the unnumbered substitute bill to House Bill 6995, authored by our Chairperson Helen Tan, subject to style and amendment, so we can consider the suggestion of Dr. Atienza, Congresswoman Garin, and FDA. So move, Madam Chair.
Madam Chair, if I may.
Yes, Congresswoman Garin.
Yeah, Madam Chair, prior to the approval of the proposed measure, I just want to have this clarified, because if we're going to discuss about substitute bill, the inputs there will actually be subject to style. But my concern here is the real gist of the proposed measure. First, on the redundancy, as I have mentioned earlier, but next, after hearing the comments of the Philippine Medical Association, hindi po kasi natutuhog, hindi po na-align. I know the intention of the bill is very good, like yung mga binibili na hindi nagagamit. However, we have to take into consideration the actual situation on the ground. What usually happens in the Department of Health, yung binibili kasi is not requested by the procurement agency. Bale, meron lang taga-bid, pero yung nagre-request kung ano yung bibilhin are program managers. So that's all offices. Like bawat hospital magre-request siya, bawat region magre-request siya. So earlier we heard about the issue of flu vaccine. There's also the issue actually of rabies vaccine. Yung mga gamot na binibili, naririnig din natin sa DILG, hindi naman minsan angot sa kailangan dun sa baba. And this is a frequent problem. So my point is, I don't think the creation of the procurement, the Health Procurement and Stockpiling Bureau will solve the problem. Because the problem here, the requisitioning officer in the first place are the program managers. So kung maglalagay tayo ng another bureau that will be redundant to the existing people, okay naman yun kung isubsume sila. But then the people handling the procurement aspect are actually holding other major tasks. Coupled with that, tali sila kasi they only procure what is requested by the program. So the accountability of the people in this new bureau will be so high, but then the faults would actually be on the program managers. Let me just quickly go into the comment. I believe one of our distinguished colleagues here commented about bakuna na pinapabayaran. That's really true. That's why before we had actually the campaign on libre po ito galing sa gobyerno. It was indirectly addressing the fact that even condoms supplied by DOH were being sold on the grounds Yung iba po kasi magpapabakuna, wala namang bayad, pero merong mandatory donation. So let's say if they would ask for a donation of 300 or 500 pesos, meron kang 3 anak, 1.5 na yun, pamasahe pa. Mas mahal pa dun sa binibili sa nabakuna ng DOH. And I believe the concept here is not just creating a bureau. The problem should be addressed holistically. You have, I don't even think creating the bureau will be the solution. The solution here is creating a body that will police. Let's say example, yung i-create natin na bureau will be a performance bureau. So kung ikaw ang may hawak ng vaccination program, dapat walang nag-expire at dapat nakakarating at yung binibili mo kumpleto. The issue on supply chain, as conveyed by PMA, yes, that's true. Kasi paulit-ulit eh. Dapat, no, what I mean is, paulit-ulit yung mga dapat na hindi ginagawa. In all procurement, because these are health-related, the supplier should deliver to the end user. Example, vaccine refrigerators, or freezers, or cold chain, or vaccine carriers. Minsan kasi babaguhin yung procurement, magdi-deliver ka ng central office. Mamang problema ngayon yung tao sa taas, paano mo ngayon yan i-deliver dun sa bawat barangay? So you simplify the task of the businessman na nag-deliver lang sila, binayaran na kaagad ng DOH, pero yung problema binagsak mo doon sa mga local government chief executives, sa DILG. So I do hope that prior to approving this, maybe we can tweak it and change it instead to a performance monitoring bureau that will include procurement, logistical implementation. So itong body will now oversee the performance of each program. Kung ikaw non-communicable diseases, dapat yung mga biniling gamot, kasi ikaw naman ang nag-request, you make sure that you request what is needed. Kasi yung mga projection na pinag-uusapan natin, it's not new. Example on vaccines, mandatory po yung 5-year projection. Because you pre-order it. On medicines, it's the same. On, let's see, the hospitals and the LGUs, they have projection. The problem is, nagkakaroon ng walang alignment. Or kung merong isang bureau na takot gumalaw kasi palaging nagpe-play safe, walang nag-oversee. So if the honorable distinguished colleague, the chairwoman of the Committee on Health, can instead tweak, before we approve it, we amend it to the creation of a performance or an oversight bureau within the department, but that will encompass. Kung may binili, sino ang nag-request? Yung nag-request, siya kasi ang nag-i-implement. Because if we just create the health procurement and the stockpiling bureau, it would simply mean the obligations and the responsibilities of the different directors and bureaus will just be transferred to a single body whose hands will actually be tired. Their hands are tied because whatever they procure is not from their budget. It's from the budget of another bureau who will make the request and who should actually handle the implementation of the program, not the health procurement and the stockpiling bureau.
Madam Chair.
Madam Chair, if I may answer.
Yes.
Yeah.
Pwede. Madam Chair,
yes.
with the indulgence of the author, since I already made a motion, maybe what we can do is we will request Representative Garin to submit her proposal or suggestion so that kasi medyo ako hindi ko masyado maintindihan yung ibig niya sabihin. Diretsuhin niya na lang kung anong gusto niyang idagdag dun sa bill. And then I hope tumatango na nga si author. She will just submit her suggestion, and I'm sure the chairperson is willing to accept the suggestion, Madam Chair, because we have still local bills to tackle, Madam Chair. So I hope you will consider my suggestion, Madam Chair.
Madam Chair, if I may, I leave it to the author. The reason why I suggested that, because if we already approve a certain bill, we cannot change it totally. Basically, to clarify, my proposal is not to create a health procurement and stockpiling bureau because of redundancy, but instead to create a performance and oversight bureau overseeing each bureau and director in the Department of Health that actually includes procurement, stockpiling, and implementation.
Madam Chair, my motion is subject to style and amendment. So we can still amend the unnumbered substitute bill, Madam Chair.
Madam Chair.
I submit, ma'am.
Yes, Congressman Tan.
Yeah, before you act on the motion of Kong Ging, I just want to inform, nalayo na po tayo sa intention ng bill ko. Ang intention po ng bill ko ay stockpiling ng mga medicines, devices, equipments na kailangan sa public health emergency. Hindi siya duplication ng regular na ginagawa po ng Procurement Bureau at saka ng supply chain management on a day-to-day basis, no? So hindi ko po babaguhin yung aking panukala na mag-create ng ganitong bureau, but I am amenable to put as a safeguard, no, in the implementation of this proposed bill to have that body who will oversee yung ating implementation or of the functions of that procurement and stockpiling bureau. So yun lang ang gusto ko pong isagot kasi medyo lumayo na tayo dahil nga doon sa problema currently of the procurement and supply chains in the ground, no? But ang main intention ng aking panukala ay stockpiling para doon po sa panahon ng outbreaks, emergencies, or pandemics. So, thank you so much, Kong Janet, on the recommendation, and thank you, Madam Chair, if we can approve na this bill so that we can tackle the local bills. Thank you so much.
Thank you, Madam Chair. Are there any other comments?
Madam Chair,
yes, Representative Edgar.
Since there is a pending motion to approve House Bill 6995, and I second the motion, Madam Chair. Thank you.
Okay. If there are no other comments from the other resource persons and members, may we act on the motion of Representative Swansing?
Seconded na, Madam Chair.
Seconded na.
Okay. So we have now approved the substitute bill subject to style and amendments of House Bill number 6995. Can we now go to the next part of the agenda?
Congratulations, Sis Helen.
Thank you so much. Thank you, Kong Janet. Thank you, guys.
Okay. I now return the chairmanship to Representative Helen Tan, our chairperson. Thank you.
Thank you to our Vice Chair, Representative Sean Acop. Thank you so much, Tita. We'll now proceed on the discussion of consideration of the local bills. First in the list, we have House Bill 2925, authored by Representative Precious Hipolito Castelo, entitled An Act Establishing a Senior Citizens Hospital in Quezon City to be known as the Quezon City Senior Citizens Hospital and appropriating funds therefore. We are now recognized. Representative. Yes,
Madam Chair, in behalf of Congresswoman Hipolito Castelo, I would like to manifest that the explanatory note be her sponsorship speech for House Bill number 2925. Thank you, Madam Chair.
Thank you, Kongging. May we hear from Sir Rod Napulan from the DOH?
Thank you, Madam Chair. As to the House Bill number 2925, as authored by, introduced by Representative Precious Cipolito Castello, let me read, Madam Chair, our position paper for our Bureau, and then we'll submit the position paper of the DOH upon approval of the Secretary. So the health facility...
Sir Rod, can you just, in the interest of time, can you just summarize the position of the DOH?
Okay, thank you, Madam Chair. So we lodged the noble intent of the House Bill number 2925 that seeks to establish a specialty hospital for senior citizens in the Quezon City. And as per our bed to population ratio of the Quezon City right now is 1:328, based on its 2020 projected population of 3 million. In the 2019 latest hospital data, there are 48 licensed hospitals in Quezon City. 35 are privately owned and 3 are run by the local government units, and 11 are operated and managed by the national government agencies. Although there are several hospitals in the area, lack of dedicated health facilities were identified for increasing number of senior citizens over the years. The Philippines has reached what is considered an aging population. According to the Population Commission, 8.2% of the total population is over 60 years old, while 4.7%, or a total of 5 million Filipinos, is age 65 and older by the end of the 2018. It is also projected that the percentage of elderly people 65 and above in the country will almost likely grow by 4.9% by year 2020, 5.6% by 2025, and 6.3% by 2030. Moreover, the Philippine Statistics Authority reported that 22.1% of the elderly population aged 65 years old and above are also disabled or are in need of increased medical attention and care. Nearly a third of older people living in poverty, which is also greatly diminished the access to the highly specialized field of geriatric medical care. So in consideration of this, Madam Chair, the Bureau interposes an objection in the establishment of the Quezon City Senior Citizens Hospital, provided it shall meet the following criteria. So yung unmet beds in the catchment area, the certificate of need obtained in the Center for Health Development, and even the feasibility study po. And would like to clarify, Madam Chair, kung saan po yung location ng facility, and it must be considered po yung integrity and safety ng hospital, yung proposed facility po, so that even the disasters and emergencies ay ma-ensure po natin na safe po yung hospital. So the bed capacity and capability of the proposed hospital shall consistent to each hospital development plan as well as the local investment plan for health. So the DOH through the HPEP may provide necessary capital outlay assistance for the upgrading of the hospital, while the local government unit of Quezon City shall ensure provision and maintenance and other operating expenses as well as the personal services. So this recommendation, Madam Chair, with the House Bill 2925 shall contribute in the implementation of the UHC to the benefit of the catchment population as well as the healthcare provider network therein, as aligned with the Philippine Health Facility Development. So respectfully submitted, Madam Chair, and morning.
Thank you, Sir Rod. Wala si Kong Castello, Precious, we can naman approve this bill subject doon sa compliance and requirements. Can we ask someone to move for the approval of this bill? Representative Edgar.
Thank you, Madam Chair, and good morning to everyone. I move that this bill be approved.
Second.
There's a motion to approve House Bill number 2925, duly second, subject to amendment and compliance to the requirements set by the DOH. Duly seconded. Is there any objection? Hearing none, the motion is approved. Thank you so much, Congging, for sponsoring House Bill 2925. We'll now proceed to House Bill number 3068, entitled An Act Increasing the Bed Capacity of the Bulalakaw Community Hospital in the Municipality of Bulalakaw, Province of Oriental Mindoro, from 10 to 50 beds and appropriating funds therefore, authored by Representative Alfonso Boy O'Malley Jr. and House Bill 3069, an act converting the Oriental Mindoro Provincial Hospital in Calapan City, Oriental Mindoro, to a regional hospital to be known as Oriental Mindoro Regional Hospital and to increase its bed capacity to 300 beds, appropriating funds therefore, authored also by Representative Boy Amali. May we hear from Representative Boy?
Yes,
Boy?
good
I'm so
morning,
sorry
good
po
morning, Madam Chair.
for taking much of your time. Thank you, sir. Thank you for patiently waiting.
Good morning, good morning. I'd like to move that the exploratory note be used as my sponsors for both the 3068 and the
Go ahead, sir.
Yeah, I'd like to move that the exploratory note be used as my sponsorship speech for House Bill 3068 and House Bill 3069.
Thank you, sir. Sir Rod, pwede bang wag na lang basahin yung mahabang position? But yung pinaka importante lang na kailangan na, for both bills, 3068 and 3069. Sir Rod.
Okay po. Thank you, Madam Chair. Madam Chair, just clarification lang po. For House Bill number 3069, it's a renationalization. So from LGU, no po.
No. Ano lang siya?
Prison bed.
Oh, parang 30, parang ano lang. Third level.
3068.
3068, that's for Bulalakaw Hospital, additional bed. And 3069, yun yung ano, yun yung converting Oriental Mindoro Provincial Hospital to a regional hospital.
Yeah. Sir, ano to? Under the jurisdiction of DOH, your proposal? Or DOH hospital siya, sir?
Regional, ano lang, magiging region, ano lang siya, third level?
Kasi yes po, but under the supervision po of DOH? No.
No. Okay, kasi nasa amin na yan, nasa ano na yan, nasa local government na talagang sa ano na yan. Ayaw namin na renationalization. Because kaya naman ng probinsya eh.
Okay.
So we fully support, Madam Chair, for the increase in bed capacity as well as the service capability upgrading, Madam Chair. And then the capital outlay subsidy may be provided by the DOH through the HPEP.
Okay.
Thank you.
And for 3069, Kong Ebcas, Kong Adrian, if you can move for the approval of both bills, 3068 and 3069.
Yes, Madam Chair, at your pleasure. I move that the proposed House Bill 3068 and 3069 be approved in this committee.
Second.
There's a motion to approve House Bill number 3068 and 3069, duly seconded. Is there any objection? Hearing none, the motion is approved. Congratulations, Kong Boy. Sorry po for waiting.
No, thank you. Thank you sa lahat. Thank you sa lahat.
Salamat po. I will now proceed to House Bill 3285. Do we have Representative Ansarudin Adjong? Do we have?
Madam Chair.
Yes, Kong Ging.
In behalf of Congressman Adjong, I would like to manifest that his...
Madam Chair.
Ay, andyan pala.
Okay, please proceed. Thank you, Kong Ging. Kong Adjong.
Madam Chair, may I request that my explanatory note be adopted as my sponsorship speech, Madam Chair.
Okay, thank you so much po. Comment from the DOH.
Thank you, Madam Chair. Yeah. For the House Bill number 3285, Madam Chair, the DOH issued a Department Memorandum number 2020-0448, dated October 16, 2020, provided the DOH EXECOM directives that recommends the establishment of separate hospitals, which its own funding operations and management rather than establishment of extension facilities that may deplete the funds and manpower of its parent hospital. So as these resources will share between the two facilities. With this, Madam Chair, na recommendation from our Execom, we propose, Madam Chair, have a separate facility from the May Pakpak because I think the proposed intent of this law is to put the WAO District Hospital under the extension of May Pakpak Medical Center, Madam Chair, which is the DOH Hospital. So with this, Madam Chair, since medyo, although the WAO District Hospitals in the landlocked area of the Lanao del Sur, we further recommend, Madam Chair, to consider the BARM also, because this is part of the Bangsamoro Autonomous Region for Muslim Mindanao, to consider the transition plan as well as the development plan in the area, Madam Chair.
Kong Adyong, are you amenable to the recommendation of the Department of Health that we instead put an independent or upgrade or convert WAO District Hospital not as an extension of Amay Pakpak under the jurisdiction of the DOH? I think that's a...
Ma'am, hindi ko naman po, Madam Chair,
Go ahead, sir.
Hindi ko naman ito tatanggalin sa BARM. Kaya lang, dahil para ma-expand ba? Para ma-expand at maraming matulungan itong WAO District Hospital. Hindi ko naman pinapa-amend yan.
Okay, as Kong Adyong, I think we have a representative from BARM. Can we hear from a representative from BARM?
I'm not amenable to it.
Representative from BARM? Anyone?
Assalamualaikum warahmatullahi wabarakatuh.
Can you introduce yourself, sir?
I'm Dr. Amirel Usman po. I am the OIC Minister of the Ministry of Health of the Bangsamoro Autonomous Region in Muslim Mindanao. Yes, sir. We would like to recognize and appreciate the effort of Representative Adjong in upgrading the WAO District Hospital because it is really timely. And this also is a catchment hospital from many municipalities from Region 12 as well as the Region 10. So, but also, I think there should be a proper consultation with regards to the point that he would like to annex the WAO District Hospital to the Amay Pakpak Medical Center. For one, Amay Pakpak Medical Center is administratively under the Region 10, and the WAO District Hospital is under the wardship of the Bangsamoro Autonomous Region in Mindanao. So there is actually a complexity in this. So maybe this can be on a separate meeting. I also thank the DOH Central Office for bringing this up. So that's all, Madam Chair.
Maganda sa DOH.
Reply Kong Adyong.
Madam Chair, kasi kung under ito sa DOH National, mas maraming matutulungan ito. So,
our problem here, sir, is the WAO under the BARM?
Yes po.
Doc? So under po siya ng BARM. So it has to, even if we approve it in this committee, it still have
Sabi ko na, hindi naman pinapatanggal sa BARM.
Doon sa BARM. Because they have the Ministry of Health, sir.
Hindi ko naman datang.
Madam Chair.
Sir, can we, I don't know if you will agree with my recommendation that we conduct a separate hearing on this with the DOH and the Minister of Health and you, so as that we refine your bill.
Okay, ma'am. Sige, ma'am. Madam Chair.
Okay.
Okay, ma'am. Okay, ma'am.
May we hear for the deferment, the motion for the deferment of the approval. Kong Ana Gaño, our Vice Chair, if you can move.
Madam Chair, may I move for the deferment of the approval of House Bill 3285. Thank you, Madam Chair.
May we hear a second? There's a motion to defer the approval of House Bill 3285, seconded. Is there any objection? Hearing none, the motion is approved. We'll just set a meeting, Kong Adyong. We'll help you. We will help you, sir. Now we'll proceed to House Bill number 4252, authored by Representative Maximo Dalog Jr. Do we have Kong Dalog?
Yes, ma'am.
Okay. Please proceed, sir.
Thank you, ma'am. In the interest of time, may I pray that my explanatory note be made my sponsorship speech, Madam Chair.
Okay, thank you so much. DOH, may we hear a comment from you?
Okay, thank you, Madam Chair. So as to the House Bill number 4552, as introduced by Representative Dalog Jr., Madam Chair, Luis Hora Memorial Regional Hospital is a DOH hospital, and currently it has a 75-bed license, and presently na-enact na po natin na mag-increase ng bed capacity to 200 beds din po itong hospital na ito. And currently, 2019 data, meron po silang 179% po yung occupancy rate with a daily average census of 134 patients. So, as mentioned po kanina during the discussion on the Apex Hospital, so kung ang direction po ng Luis Hora is to the second, will be the second Apex Hospital in CAR, in the Cordillera Administrative Region, after we already issued out a policy for the Baguio General Hospital and Medical Center po. So with this, Madam Chair, we interpose no objections on the proposed measure to upgrade the service capabilities of Luis Hora Memorial Regional Hospital, provided that po the upgrading and expansion should be consistent to each hospital development plan. The master site development plan is also developed, as well as the availability of the lot and space will be ensured. Ang isang problem din po right now for the Luis Hora, although yung mandate po nito is papunta dapat sa regional hospital, at least level 3 hospital po ito, with specialty services. So doon pa rin po papunta din naman yung direction po ng Luis Hora Regional Medical Center, Regional Hospital po natin. And just to mention din po, Madam Chair, na meron pong House Bill right now na na-approve po na ninyo, as well as po sa Senate na ongoing at the committee level, na ang DOH na po yung mag-set ng service capability at saka capacity for the DOH hospitals. So yun na po, Madam Chair, but basically we...
Anyway, yung bill naman... Okay, thank you. Ang bill naman niya is parang converting it into emergency medical service and trauma center. So subject to compliance on the requirements set by the DOH. Can we hear someone, Kong Adrian, for the approval subject to the compliance to the requirements set by the DOH po and amendment, sir?
Thank you, Madam Chair. I move that the House Bill 4252 be approved subject to the compliance and its requirements set by the DOH.
I second.
Okay, there's a motion to approve House Bill 4252 subject to the compliance set by the DOH subject to style and amendment. Duly seconded. Is there any objection? Hearing none, the motion is approved. Upon the request of our representative Ted Resco has been requesting that his bill be tackled first. We'd like to jump to item number 10 on House Bill number 5427. Yes, you can proceed, sir. Representative Resco.
Yes, thank you. Thank you, Madam Chair. Madam Chair, esteemed colleagues, may you take my bill as my explanatory note for the Dr. Rafael Tumbocon Hospital, Madam Chair. Thank you, Madam Chair.
Maraming salamat po. Short comment, Director Roderick.
Okay, ma'am.
Promote ka na ba?
Hindi pa, ma'am.
Oh, okay, sige.
Okay. Ma'am, as to the House Bill number 5427, we fully support for the upgrading as well as for the increase in the bed capacity of the Dr. Rafael S. Tumbucon Memorial Hospital, Madam Chair.
Thank you. Can we hear a motion for the approval? Representative Nag-Anyo, our Vice Chair.
Madam Chair, I move for the approval of House Bill 5427. Thank you.
Again.
There's a motion to approve House Bill 5427. Duly seconded. Is there any objection? Hearing none, the motion is approved. Okay.
Madam Chair.
Congratulations, sir.
Thank you, Congressman.
Okay. For items number 11 and 12, I think Representative Balindong is with us today. May we call him to sponsor House Bill 5464 and 5478.
Thank you, Madam Chair. May I just move that my explanatory note be adopted as my sponsorship speech.
Thank you, sir. Sir Rod, can we hear a comment from you both for 5464 and 5478?
Madam Chair, would like to clarify na po, Madam Chair, on the 5464 as well as for the House Bill number 5478. Is this still under the DOH BARM po, not under the Department of Health? Yun po yung intent ng measure, Madam Chair.
Under BARM.
Okay. So we fully support, Madam Chair, for this bill, Madam Chair. And pa-add na lang po kami, Madam Chair, ng Hospital Development Plan na provision so that we can adjust the bed capacity eventually at saka capability po, depending on the catchment population, yung burden diseases, etc. Madam Chair.
Okay, so subject to style and amendment. May we hear a motion for the approval?
Madam Chair,
Pongging.
I move for the approval of the two bills subject to the compliance of the author to the requirement of the DOH.
Second.
Okay, there's a motion to approve House Bill 5464, subject to the compliance to the requirements set by the DOH, and House Bill 5478, subject to style and amendment, duly seconded. Is there any objection? Hearing none, then the motion is approved.
Thank you, Madam Chair.
Thank you. Congratulations, sir. Do we have, I think Representative Alexi Tutor is with us, our Vice Chair. For House Bill numbers 7683 and 7684. You have the floor, ma'am, to sponsor your bills. Oh, she's not here. What about?
Madam Chair, can I be recognized,
our
please?
Vice Chair. Yes, Kong Marilu.
Yes. This is for House Bill 4763, authored by Kong Kiko Benitez. He has asked me to read it for him. His explanatory note, which I will send to you, but he asked me to please implore that the Teresita Lopez Alandoni Provincial Hospital in Silay City, where most of our, where all our planes arrive.
Tita, for a while po. Tita, for a while lang po. I was calling earlier Representative Alexi Tutor for House Bill 7683 and 7684. Since she's not here, I will now jump to item number 8 on House Bill 4763, authored by Representative Jose Francisco Benitez, to be sponsored by our Vice Chair Marilu Arroyo. Go ahead, Tita.
Thank you, Madam Chair. I will send you his explanatory note because the first portion is what the Constitution guarantees our people. But most important is this. He asked me to read this. Our Teresita Lopez Alandoni Provincial Hospital in Silay City, Negros Occidental, is in miserable condition. The hospital authorized bed capacity is 100 beds. However, based on data from the hospital, its bed occupancy rate in 2018 was 300% higher than its capacity. The number of inpatients in the same year totaled 22,014, or 60 patients admitted every day, staying for 5 days or more on average. Clearly, this hospital needs more beds. That is all, Madam Chair. And I will send you his, what do you call this? His House Bill number 4763 as his explanatory note. But he asked me to please mention the bed capacity of Teresita Halandoni Hospital in Silay.
Thank you,
City.
Thank you po, Tita. Kong Marlu. Sir Rod.
Thank you, Madam Chair. On the House Bill number 4763, Madam Chair. Actually, Madam Chair, the bed occupancy rate, as mentioned din kanina ni Kong Arroyo, 378.77% na po siya. Actually, umaabot na siya ng 379 yung daily census po ng hospital. Maybe hindi nga lang po siguro nasa 300 yung increase niya, but much higher. But however, we need to emphasize din, Madam Chair, na siguro we should come up with a provision on the hospital development plan so that we can ensure din po na compliance siya sa mga requirements, as well as catchment population, increasing catchment population sa burden of diseases, as well as the healthcare provider network niya, Madam Chair. So with that, Madam Chair, we fully support for the increase and upgrading of this hospital. This is also serve as the gatekeeper then papunta sa may Corazon, Locsin, Montiliban Regional Hospital. So para ma-decongest din po namin yung DOH hospital po namin sa Bacolod City.
Okay.
Thank you, Madam Chair.
Thank you so much, Sir Rod. Our Vice Chair, Kong Maricel, can I hear a motion for the approval?
Madam Chair, I move for the approval of House Bill 4763, subject to style and amendment. Thank you.
There's a motion to approve House Bill 4763, subject to style and amendment. Can we hear a second?
I second the motion, Madam Chair.
Duly seconded. Is there any objection? Hearing none, the motion is approved. I think Representative Alexis Tutor is here na. Do we have a representative?
Yes.
Yes.
Madam.
Please sponsor House Bill 7683 and 7684.
Yes po, Madam Chair. Thank you so much. Good noon, everyone. To expedite our discussion, Madam Chair, I would like to move for the adoption of my explanatory note for both House Bill number 7683 and 7684 of its explanatory note as my sponsorship remarks. Thank you, Madam Chair.
Sir Rod, thank you, Kong Alexi.
Thank you, Madam Chair. On the House Bill number 7683 as well as the 7684, Madam Chair, our understanding is this, and still under local government unit po yung supervision and control of this. And then the bill also suggesting that the DOH shall provide the capital outlay requirements subsidy for the upgrading as well as for the increase in bed capacity of the hospital. So with this, Madam Chair, we fully support for the upgrading as well as for the increase in bed capacity of these hospitals, provided that it's consistent with the hospital development plan as well as the local investment plan for health po ng LGU. So and through the HFEP, the DOH shall provide the capital outlay requirement subsidy for the upgrading expansion. Although, Madam Chair, just to note lang po, yung occupancy rate po ng dalawang hospital is less than 80%. But we are looking forward na once ma-upgrade yung facility, ma-improve yung service capability, baka tumaas na po yung occupancy rate ng dalawang hospital na to. The bed to population ratio po ng Bohol right now is 1:1,196. With this hospital upgrading and expansion in the number of the bed capacity, this will improve further po yung service capacity po natin sa buong Bohol. So we fully support with this measure, Madam Chair, and but still, this should be under the local government unit. Thank you, Madam Chair.
Okay. Kong Alexi, do you have additional inputs or should we approve na this?
Yes po, Madam Chair. Kailangan po ng Bohol, and it is also in my district, and both of these hospitals are really need to be increasing their bed capacity already, Madam Chair. And with this, if approved po, Madam Chair, it would be a big help to my constituents in the 3rd district po. Thank you.
Okay, thank you so much to our Vice Chair, Kong Alexi. May we hear a motion for the approval, Kong Ebcas, Adrian?
After hearing comment from DOH, I move that the proposed House Bill 7683 and 7684 be approved, subject to the style amendments.
There's a motion to approve House Bill 7683 and 7684, subject to style and amendment. Can we hear a second?
Second the motion.
Seconded. Is there any objection? Hearing none, the motion is approved. Do we have Representative Eric Olivares, Chair Eric, for House Bill number 5565?
Good noon, Chair.
Sorry, sir. Skip ko po kayo.
Thank you. In the interest of time, I would like to adopt my explanatory note as my sponsorship speech, Madam Chair.
Okay. DOH,
thank you.
One short comment.
Yeah, thank you, Madam Chair. We fully support for the upgrading of this, Madam Chair, for service capability. But we would like also to mention, Madam Chair, that as we increase the service capability, maybe we consider also our service capacity as to the authorized bed capacity of the hospital, Madam Chair. But nonetheless, Madam Chair, since this is a highly urbanized city, so what we are expecting for our UHC as well as the Philippine Health Facility Development Plan is at least nasa level 2 po sila. So it's very timely po, and we're very fully support on this, especially for the capital outlay requirements po niya and for technical assistance po na we can provide from the Department of Health, while the operations and management of this hospital is still under the local government po ng Parañaque. Thank you, Madam Chair.
Okay, Kong Eric, so this bill intention is to just upgrade, but still under the supervision and management of the DOH. Just want to clarify the intention, Chair Eric Olivares.
Yeah, this is for the upgrading of its hospital ng Parañaque from 1st level to 2nd level community hospital, Madam Chair.
Okay, thank you so much. May we hear a motion for the approval of this bill, Representative Adrian Ebcas?
Madam Chair, I move that the proposed House Bill 5565 be approved on this committee, subject to the style and amendments.
There's a motion to approve House Bill 5565, subject to style and amendment. Can we hear a second?
Second, Madam Chair.
Motion.
Duly seconded. Is there any objection? Hearing none, the motion is approved. We'll go back to item number 6 on House Bill 4704, authored by our former Speaker, Representative Pantaleon Alvarez. And we hear from Representative, our Vice Chair, Kong Sean Acop, to sponsor 4704. Kong Acop. Okay, can we hear from anyone to sponsor Kongging?
Madam Chair.
Anyone Kongging sponsor, please, House Bill 4704.
Kong Ebcas, Madam Chair.
Yes po, go ahead, sir.
I move that the explanatory note of the sponsorship bill of House Bill 4704 be adopted.
Okay, can we hear short comment from UH? Tayo yata yun.
Okay, thank you, Madam
I'm so
Chair.
sorry, medyo nagiging unstable po yung aming connection. Go ahead, Sir Rod.
Thank you, Madam Chair. So, Madam Chair, the intent of this bill is to make an extension hospital from the Davao Regional Medical Center, and this primary care facility in Sawata, San Isidro, Davao del Sur. So with this, Madam Chair, as I mentioned a while ago po, Madam Chair, we have this execom directives that instead of coming up with a extension hospital, we prefer to have a new and independent hospital from the mother or a parent proposed hospital, Madam Chair. And then, Madam Chair, since this is a primary care facility, what we are recommending, Madam Chair, is that the capital outlay requirements may be provided by the DOH through the HPEP, while the operations and management of this hospital will still be under the local government unit as mandated by the local government code, Madam Chair. Thank you, Madam Chair.
Okay. Thank you so much. Since wala po yung ating principal author, pwede subject to style and amendment lang. Can we hear someone, our Vice Chair, Kong Maricel, for the approval of this bill?
Madam Chair, I move to approve House Bill 4704 subject to style and amendments and DOH requirements. Thank you, Madam Chair.
I second the motion, Madam Chair.
There's a motion to approve House Bill 4704 subject to style and amendment and compliance to the requirements set by the DOH duly seconded. Is there any objection? Hearing none, the motion is approved. We'll now proceed to House Bill 4731, authored by Representative Precious Hipolito Castelo. Do we have Kong Precious? If none, can someone sponsor? Can we ask someone to sponsor House Bill 4731?
Madam Chair?
Yes, Kong Maricel.
I would like to sponsor House Bill 4731 on behalf of Representative Castelo and manifest that her explanatory note be made as her sponsorship remarks. Thank you.
Thank you, Kong Maricel. Short comment, Roderick, Sir Rod.
Thank you, Madam Chair. So the intent of the measure, Madam Chair, is to establish a district hospital under the local government unit of Quezon City, Madam Chair. So with this, Madam Chair, the DOH fully support for this as we will improving the accessibility to the healthcare facilities, especially to the hospital services in the area of Batasan. I think this is the hospital across the Batasan po. So with this, Madam Chair, we fully supports for the capital outlay requirements, subsidies that the DOH may provide it, while the operations management for the PES and MOE shall be will be provided by the local government unit of SC. Thank you, Madam Chair.
Okay, thank you so much, Sir Rod. Can we hear a motion for the approval of this bill?
Madam Chair, I move. Am I recognized, Madam Chair, for a motion?
Sir.
Thank you.
Yes,
I move
sir.
that the House Bill 4731 be approved. Subject to the style amendment.
Okay. There's a motion to approve House Bill 4731 subject to style and amendment duly seconded. Is there any objection? Hearing none, the motion is approved. And last but not the least is item number 9, House Bill number 5204 or 04, authored by Representative Alfred Vargas. Do we have Representative Vargas? Okay, can we ask Representative Alexi Tutor to sponsor the bill of Representative Vargas?
Yes, Madam Chair. In behalf of Representative Alfred Vargas, I move that his explanatory note of House Bill 5204 be adopted as his sponsorship remarks. So move, Madam Chair.
Thank you, Kong Alexi. Sir Roderick. Sir Rod.
Thank you, Madam Chair. As to the House Bill number 5204, So this is a primary care facility, Madam Chair, as we classify the Super Health Center in Lying-in Clinic. With this, Madam Chair, we reiterate that this health facility will, the operations and management of this facility will be under the city government of Quezon City. So the capital outlay requirements subsidy may be provided by the DOH through the HFEP, Madam Chair. But we fully support for this measure, provided that the LGU still operate this facility, Madam Chair. Thank you, Madam Chair.
Thank you. And we hear a motion for the approval of this bill, Kong Adrian.
Madam Chair, I move that proposed House Bill 5204, introduced by Kong Alfred Vargas, be approved, subject to the style and amendments.
Second.
There's a motion to approve House Bill 5204, subject to style and amendment, duly seconded. Is there any objection? Hearing none, then the motion is approved. Finally, thank you so much for your patience, no? And for actively participating in this committee hearing. Maraming salamat po, Kong Adrian, for always attending our meeting. Kong Ging Swansing, for always being with us, and our vice chairs. Kong Roderick, one last point before we adjourn, may I ask our guests from the Department of Health, the DOH Procurement and Supply Chain Management Team, the Procurement Service, the DBM, FDA, DTI, DND, DILG, DSWD, DOF, National Disaster Risk Reduction and Management Council, PCHRD, ITC, PRC, Philippine Red Cross, PMA, and other organizations to kindly submit your additional input or position on the stockpiling bill, no? On the Health Procurement and Stockpiling Act, the unnumbered substitute bill to refine our proposal, no? So maraming salamat po sa inyong lahat. Can we hear the favorite motion?
Madam Chair, I move that this committee meeting be adjourned.
There's a motion to adjourn the committee hearing, duly seconded. The meeting is now adjourned. Maraming salamat po sa inyong lahat.
Thank you, Chair.
Enjoy your
Thank you, Madam Chair. Enjoy everyone.
Thank you so much. Thank you. Thank you, Comsec, Ma'am Sylvia. Thank you sa team.
Thank you, ma'am. Welcome po.